Next, we'll begin the Ellisys Sense treatment. Ellisys Sense allows you to turn the suction on and off with this button. Press the standby button, then the orange button again to activate suction. RF energy is delivered only when the foot switch is pressed in auto mode. So simply placing the tip won't activate RF. As you can see, the suction gently lifts the skin. The suction leaves an outline of the tip, making it easy to see the treated area. That's why I recommend overlapping each pass by about 30% for complete coverage. Let's begin. Are you comfortable?
Yes.
I even perform this treatment on myself without anesthesia. Even so, it's always important to check that the patient is comfortable. While RF is being delivered, the tip lights up purple. Some operators follow the light, but I prefer watching the needles retract through the transparent tip before moving. Although suction provides good contact, on curved areas or over eyebrow hairs, I gently press the skin to improve suction before treating. Many patients come in because of heavy eyelids or reduced skin elasticity around the upper and lower eyelids. Treating both the forehead and eye area can enhance eyebrow lifting, similar to the effect of skin Botox. According to Professor Akima's presentation, lifting the superficial skin layers may provide a stronger lifting effect than deep point injections. Since Ellisys Sense targets the dermis, it can be especially effective for lifting around the eyes and brows. If suction isn't ideal, ensure good tip contact and apply gentle pressure to maintain RF delivery.
괜찮나요?
I've completed about 100 shots on one side of the forehead and eye area. Now I'll adjust the depth and treat the eyelid. Let's begin the eyelid treatment. That was exactly 100 shots. I'll repeat the same procedure on the other side. I'll start with the eyelid on this side. I'm using the 25-pin tip for Ellisys Sense. The 25-pin insulated tip protects the skin surface from RF energy. With suction and bipolar RF, it can even be used safely on the eyelids. I'll continue with the eye area.
Ready.
Now I'll treat the eye area and forehead together. Let's begin. The suction isn't as strong as some air injectors, but it's strong enough to maintain stable contact. Patients with delicate skin may develop temporary suction marks. These marks can last for about 3 to 4 days, similar to in-mode FX. It's helpful to explain this to patients beforehand. During RF delivery, suction is not continuously applied, so skin may slightly separate on curved or hairy areas. In those areas, I apply gentle pressure with the tip during treatment. One advantage of needle RF is that the microchannels remain open for about 6 hours. We can inject products with needles or cannulas, or make microchannels on the skin surface. Applying topical products while these channels are open can help speed up recovery. It can also improve overall skin texture. After treatment, I apply products such as exosomes or chitosan to reduce inflammation, support skin regeneration, and boost collagen. This completes the Ellisys Sense procedure. Since the microchannels remain open, I recommend avoiding heavy makeup and irritating skincare products for about 6 hours. Also recommend keeping the skin well moisturized and applying sunscreen. As you can see, the treated areas are red and swollen. Because Ellisys Sense delivers dual depth treatment, noticeable swelling can occur even after a single pass. Redness and a warm sensation may last for 3 to 4 hours. And in sensitive patients, swelling may continue for up to 3 or 4 days. For Ellisys Sense, I generally recommend 3 sessions at 1-month intervals. Since it is more invasive than many other treatments, I often recommend spacing sessions about 6 weeks apart. JUVELOOK eye is also usually performed over 3 sessions. However, polymer response varies, so some patients achieve satisfactory results after only 2 sessions. About 6 weeks is an appropriate interval for evaluating the response. Since the treatment schedules align well with Ellisys Sense, combining them during the same visit is convenient. Today, we performed a combination treatment using Ellisys Sense and JUVELOOK eye for the periorbital area. This patient had mild under-eye bags with surrounding volume loss. The patient also wanted lighter eyelids and eyebrow lifting. For JUVELOOK eye, 1 vial was mixed with 4 cubic and a total of 1 cubic was evenly injected on both sides. We used a 25-gauge cannula and the 25-pin insulated tip for Ellisys Sense. For dual-depth treatment, the periorbital area was treated at 1.0 millimeters and 0.8 millimeters, while the eyelids were treated at 0.8 millimeters and 0.6 millimeters. During the first 2 weeks, the under-eye volume may appear to decrease as swelling subsides. By about 6 weeks, collagen remodeling begins and the under-eye area gradually becomes fuller. From around the 3rd day, swelling improves, pores become tighter, and the eyelids begin to feel lighter. Thank you for watching. I'm Dr. Chang-Il Yoon from YoonㅣPart.2 Clinic, Mokdong Branch.